Did you know that most babies and toddlers need a vitamin D supplement? Vitamin D is an essential nutrient for normal bone growth and for other bodily functions in young children. I'm Jill Castle. I'm a pediatric dietitian and mom of 4. I've helped thousands of families improve the health of their kids through food, feeding, and understanding child development, and of course, cultivating healthy lifestyle habits. In this video, I'm talking about vitamin D for babies and toddlers. You're going to learn why they need it, how much they need, and what foods are good sources of it. So let's get going. Vitamin D has a lot of different functions in the body. I have heard that there is a receptor for vitamin D in every cell of the body. I can't verify that, but it tells me that vitamin D is pretty important. Today, we're going to focus on bones in healthy growing children because vitamin D is essential to help calcium get into the bones so they can mineralize or get hard. So babies are born with soft, smushy, spongy-like bone material, and it's through movement, weight-bearing exercise, their diet, the sources of vitamin D they get from the foods and the beverages that they eat and drink, and their exposure to sunlight that helps their bones get the vitamin D it needs so they can get strong and dense and hard. So vitamin D is oftentimes called the sunshine vitamin. It's because when the sun touches our skin, it activates vitamin D in our skin and converts it to the type of vitamin D that can be deposited in our bones. So yes, children can make vitamin D from sunlight, and that's why we call it the sunshine vitamin. The catch is, however, that we don't let kids sit out in the sun unprotected. We cover them up with clothing or we put lots of sunscreen on them to protect their skin. And when we screen the skin, either with a lotion that has sunscreen in it or clothing, the sun cannot convert and activate that vitamin D in the skin. So that's a limitation. So what vitamin D does while it is making bones hard and dense and strong is it mineralizes that bone, as I mentioned, which helps the bones develop normally. So when bones are weak or too soft, when a child grows, the bones can grow abnormally and they can become misshapen. So if you've ever noticed an individual with bow-leggedness, that oftentimes can be a result of early childhood vitamin D deficiency. So in a nutshell, babies and toddlers don't get enough sun exposure to make vitamin D in their skin. Breast milk, which is another form, a major source of nutrition for breastfed babies, is not a good source of vitamin D. And infant formula, which is supplemented with vitamin D, it has vitamin D in it. Unfortunately, babies aren't consuming enough formula to meet their daily vitamin D requirements. So it begs the question, how much vitamin D do babies and toddlers actually need? So let's talk about babies. We know in the first 12 months of life, babies need 400 international units of vitamin D. This is typically given in day 2 or 3 of life. It's when pediatricians recommend vitamin D get started, and babies get started on day 2 or 3 of life and they stay on it for the first year of life and oftentimes into toddlerhood. So let's talk about the breastfed baby. Breast milk is the gold standard. It is the recommended first food for all babies. If mothers can nurse or provide breast milk in some way, shape, or form, that is the recommended path. But we know that not all mothers choose to or are able to breastfeed, so that's where infant formula comes into play. But when we look at the composition, the nutritional composition of breast milk, it does not have enough vitamin D in it to meet the daily requirements that infants need in that first year of life. That is why pediatricians recommend that young babies take a vitamin D supplement. Now let's talk about the babies who are consuming infant formula. Infant formula includes vitamin D at a level that should supply enough vitamin D for your baby. However, your baby needs to be consuming a liter of infant formula each day in order to get enough of that vitamin D or that full dose. So that is why we recommend that infants have a vitamin D supplement, even if they're on infant formula. Simply, they cannot consume a liter of formula every day when they're young. So they don't get that full quote unquote dose of formula to get the full 400 international units of vitamin D. So in other words, they need a daily supplement of vitamin D until they are drinking a full liter of infant formula. So how do we give vitamin D? Typically, it's a liquid supplement using a dropper, which you can place a drop in the mouth of your baby. Some mothers will put it on their nipple if they're breastfeeding, or you can put it directly in infant formula if your baby's taking a bottle. What about the toddler? How much vitamin D does the toddler need? So after your baby turns a year of age, the vitamin D requirements are going to go up a bit. They're going to increase to 600 international units per day. In order for a toddler to meet their vitamin D requirements, we're looking at a diet of solid foods that are good sources of vitamin D, and I'll talk about that in a minute, and supplementation. Again, you can continue with the vitamin D drops directly in the mouth of your toddler or mixed into food or other liquids. So let's talk about vitamin D rich foods. There are limited sources of vitamin D rich foods. You can have natural foods that are naturally rich in vitamin D, which there are a few, or you can have fortified foods like milk. Vitamin D milk has been fortified with vitamin D. Fortified cereals, so boxed cereals like Oreos types of cereals, they are fortified with different nutrients. Vitamin D is one of them. Fatty fish is a natural source of vitamin D. It's going to already have vitamin D in it. As you can tell, of all these foods with vitamin D, your child will still need a little extra from a supplement. Most toddlers will need a vitamin D supplement during these early stages of life. Other natural sources of vitamin D in terms of food are egg yolks, so the yellow part of the egg, and mushrooms. Mushrooms are a natural source of vitamin D. But as I mentioned, other foods are fortified, like a cereal, ready-to-eat cereals, some dairy products. In addition to milk that's fortified with vitamin D, there are some dairy products like yogurt that you can find as a source of vitamin D. Also, some juices are fortified with vitamin D, like orange juice. So these are foods that you can look for to add to your toddler's diet, but I also want you to recognize and understand that the foods that are available are somewhat limited. So in order to make sure your child's getting enough vitamin D, you can give your child a supplement. Now, let's wrap this up. Vitamin D is important for normal bone growth. Most babies and toddlers will need a vitamin D supplement. And if you have worries or concerns or you want specific advice for your child, make sure you talk with your healthcare provider or your dietitian. So, thank you so much for staying here. If you want to make sure you're doing the best with food and feeding, make sure you check out my books, my program called The Nourished Child Blueprint, and my other videos on this channel. Share them with someone you care about, and I'll see you next time.